Welcome, everyone. Thank you so much for joining us for this AMPO webinar. My name is Ellen Zabiska. I serve on the AMPO staff as Transportation Planning Manager. So glad you're here with us today. This webinar is brought to you by our Transit Interest Group. We have 7 different interest groups, and we have volunteer leaders for each of those groups that help us put together these webinars. We couldn't do this work without our volunteers, so we really appreciate those folks, including our moderator today. So I'm going to do one quick housekeeping slide, ask you to keep your mic muted while our presenters are speaking, but you are welcome to put questions and comments in the chat box at any time. We encourage conversations over there. We do record the webinar, and we'll share that recording and the slides and the notes on our member platform within a couple weeks. And if you don't mind adding your organization to your Zoom handle so we know where you're joining us from, that would be great. So I'm going to introduce our moderator for today. Megan Fowler is one of those leader volunteers for our Transit Interest Group. She's the Transit Director for the Southern Georgia Regional Commission in Valdosta, Georgia. SGRC is the rural transportation system that operates within an 18-county region, and she's responsible for the oversight and administration of that transit system. And she's also the AMPO coordinator there. She's been with the Southern Georgia Regional Commission since 2020. She's a native of Valdosta, went to school at Valdosta State, and she has 13 years in planning compliance and grant administration, and is RPO council member for the Rural Planning Organizations of America. So she really knows what she's doing. And with that, I will turn it over to Megan and invite her to introduce our topic and speakers. Thanks, Megan.
Great. Thank you, Ellen. A little bit about today's topic. Today's conversation is all about how metropolitan planning organizations can meaningfully support transit in suburban and rural communities. These areas often face unique mobility challenges, but they also present huge opportunities for creative, community-driven solutions. During this session, we'll look at real examples from across the country and talk through what's working, whether it's coordinating effectively with local transit providers, expanding access to essential services, or finding the right planning and funding strategies to make rural transit both practical and sustainable. By the end of our time together, you'll walk away with actionable ideas for improving connectivity and supporting mobility options that truly meet the needs of the regions that you serve. Okay, and today we have with us Stone Pinson. He's the Chief of Strategy at RMS, where RMS stands for Resource Management Systems, by the way, where he leads long-term planning system expansion and operational integration for a multi-state public transportation provider. His work focuses on building efficient, scalable, and sustainable transit systems through government contracting, fleet strategy, funding planning, and performance management. With extensive experience collaborating with local and state agencies, he navigates regulatory environments and aligns day-to-day operations with broader mobility and infrastructure goals. Based in Southwest Georgia, he is also active in local government and community leadership, giving him practical insight into how transit systems affect communities. So please help me welcome Stone Pinson. Oh, and I also have Dr. Oliver Page. I'm so sorry. Dr. Oliver Page is the Deputy Director at Augusta Transit, where he leads transit service planning, system development, contractor oversight, and compliance for operations and maintenance. He focuses on strengthening community and stakeholder relationships to enhance overall service delivery. He holds a PhD in civil engineering transportation from the University of South Florida and is a certified community transportation manager. A passionate transit nerd, Oliver regularly rides and evaluates both formal and informal transit systems wherever he goes. So help me welcome both Dr. Page and Stone Pinson.
Thank you, Megan. Appreciate you. I'm glad to be here. Everybody bear with me as I try and present my PowerPoint to you. I'm not great at it. Can everybody see that, or is it on the wrong screen?
It's showing your desktop, Stone.
All right. You see it now?
Not yet.
Want me to bring up my slide, Stone?
If you can, that would be fine. Or I might be about to figure it out. Oh, there you go. That works. See that? Thank you, Alan.
Sure.
All right. So my name is Stone Pinson. I'm Chief Strategy Officer for TransSouth and Resource Management Systems, like Megan mentioned. TransSouth is our parent company that kind of has multiple transportation businesses under it. One of them being Resource Management Systems, which focuses on public transit, particularly rural transit. And so that's kind of what I'll be talking about today. Next slide, please. So our rural transit footprint, we operate roughly 15 rural transit systems across Georgia and Virginia at the moment. We serve approximately 75 counties through those states, operating roughly 250 vehicles with 325 drivers. So about annually, we're performing over 700,000 trips. And the programs that we operate and span include 5311, 5310, 5307. Those are the FTA funded programs. We often perform services under Medicaid, Medicare, DHS, and other purchase of service contracts inside of those systems, which I'll get to in some later slides. So some of the key challenges around rural transit I thought would be good to start off with. Limited funding. If you're familiar with 5311 programs or even some of the other stuff, they are partial funding and you're trying to make up the other half of the funding a lot of the time. Some of the other problems are buy-in from small local governments or county agencies that we see a lot of times. And they don't want to deal with the headache or have to come out of pocket in their general funds for budgets for a transit system in a rural area. And same with a city MPO planning organization wanting to come out of pocket and budget for a rural transit system to serve non-residents of the metro area. But, some of the other challenges we see are limited coordination between transit systems. So both of those are not serving the same members. Metro systems don't much overlap a lot of the times in systems and coordination of communication to a rural and vice versa. And this is partially because of funding boundaries between the federal programs. So if you're familiar with operating 5311 and 5307, they have clearly defined boundaries based on those funding codes that don't allow them to very rarely cross, which I'll kind of get into a workaround in the next slide. But some other daily difficulties are recruiting drivers and retaining staff, and just other major differences between rural and urban service models, such as fixed route, microtransit, and demand response. So, all right. So some of the biggest disconnects, I would say, are the funding boundaries. And I think many of you who have experience in this would agree. The urban transit programs are operating under 5307 funding a lot of the time, which don't allow them to cross over into the rural. And the 5311 funds are not allowing them to cross over into the urban systems. So creates a real problem for the riders who just know transit and they know they need to get to a destination. They don't very rarely understand that this vehicle can't take them into their urban appointment or vice versa. So, yep, next slide. So practical workaround we've found in Georgia, at least, is we often bridge funding gaps using alternative funding sources. So we take the 5311 vehicles that we operate in the rural systems and we contract with Medicaid or Medicare or another funding source to make up the funding for that trip, for that rider. So oftentimes a rider may call and say, I would like to go from this rural area to this urban area or vice versa. But the 5311 funding alone will not let them go across those boundaries. So oftentimes we are triaging and saying, okay, well, are you eligible under a Medicaid provided contract and revenue stream, or Medicare, or another Department of Human Services contract that can pay for this trip? And this does multiple things. It helps us get around the funding boundaries, it funds the trip, and in many cases, it creates a surplus for those 5311 and 5307 programs to operate on. Thank you. Does anybody have thoughts or questions or experiences around that last slide before we kind of move on? All right. So some of the things we can do looking forward, in our opinion, and what we're trying to do in many of the systems we're operating, is encouraging stronger coordination between systems, looking at different funding and regional aspects to kind of break down some of those barriers. Because at the end of the day, we're trying to serve, the rider and fulfill their needs. So it's kind of how can we get to fulfill that need within the rules of the systems. So, some other things we see that need to happen and are happening and will happen, but need to continue being pushed, is integration of technology and platforms, especially where systems, much like Augusta Transit operates, is they're operating a metro system and the rural system in one. So find a software that can kind of bridge the gap and make it more seamless for the riders to go from those rural areas to the bus stop and then on into their urban destination, or vice versa. Micro transit is, I think, really catching on in the urban areas. We see that as a large shift coming in the future. So getting people not necessarily from a bus stop to the next bus stop, but from point A to point B directly in a more economical and efficient manner. And expanding partnerships with NEMT and social service programs. So that's the funding breakdown that I mentioned earlier, and finding alternative funding for those trips to be able to perform them across boundaries and get the trips covered in a financial manner. All right. I think that's my last slide there. I'll open it up for questions that you all may have.
Okay, thank you, Stone. If there are no questions, I'll open up a poll for anyone to feel free to respond to. Let's see, let's launch the poll. And this question is about your MPO size. So just please enter your responses. They're small, medium, or large based on population.
Megan, we've got a question in the chat from Will in Nashville.
Okay. See if I can transition over to.
Will, you're welcome to unmute and share if you'd like to.
Hey,
Yes.
yeah, we have a rural, we have a public transit roundtable we started last year, and we include the rural transit authorities, and we talk a lot about aging in place because our MPO is hosted by a regional council, which has the aging and disability organization, and yeah, our rural riders typically older than urban riders. Like, is transit working to help people age in place instead of having to move to a suburb where they live in a assisted home?
I would say absolutely. And that's kind of the coordination we're trying to get here is, that aging population that is wanting to age in place is, a lot of the times medical centers in the hubs, specifically in Nashville, are in the urban areas, and they don't want to live in the urban areas. So you've got to come up with a route or a solution to get them from the rural to the urban and back home in a seamless manner for them. So,
Okay, and there's another question in the chat from Sean. Did you face any difficulty coordinating trips beyond jurisdictional boundaries?
we do pretty regularly. Sometimes there are cases where we can't accommodate a member, and that may be the case. But a lot of the time, there's a workaround that we've found to help that member get where they need to go. But I will say, occasionally, there's times where we really can't come up with a solution for them.
Okay, so based on I'm going to stop sharing the poll and I'm going to share the results with everyone. It looks like the majority is 55% of the medium-sized MPOs. And then we have 26 in the small and 19 in the large. Okay. Okay, so Ellen, can we pull up Dr. Page's presentation if we're ready to transition?
Sure, Dr. Page, you can share your slides if you'd like.
Thank you, Stone.
Yep, thanks, Stone.
Yeah, thank you.
Dr. Page, looks like you're muted. If you're okay, there you go.
Can you see me now? Or can you hear me now?
Yep.
Good afternoon, everyone. My name is Dr. Oliver Page, Deputy Director of Augusta Transit, and my presentation is Shifting Urban-Rural Boundaries, Creating Micro-Transit Opportunities here in Augusta, Richmond County. See how I move this slide. One moment. Hey. Richmond County, Augusta Richmond County, established in 1736. It's a consolidated city county. Before 1998, there was City of Augusta and Richmond County. The consolidation merged the City of Augusta and Richmond County. So when people speak about Augusta, the population of Augusta being 206,000, that's Augusta Richmond County population. There isn't a sort of City of Augusta boundary. So the population of Richmond County, Augusta, is approximately 206,692 persons per square mile. The mayor is Garnett Johnson, and Richmond County is in east central Georgia, bordering the Savannah River. One side is Savannah, and we're on the Georgia side, and it's also home of the Augusta National Golf Club. Augusta Transit, and we are a small urban transit operator. We have 9 fixed routes, 11 motor buses, 5 battery electric buses that arrived last year. We have 9 ADA vans, 412 unlinked trips in 2025 for our fixed route. We contract out. Our current contractor is MV Transportation. The City of Augusta decided to privatize Augusta Transit in 2011. And the main funding sources for Augusta Transit is 5307 and 5339. 5307 is capital and operations. 5339 is bus and bus facilities. Richmond Transit, which is our rural operator, because Augusta Richmond County has an urbanized part and a rural part, and that forms the foundation of my presentation today. Richmond Transit started in 1989. It's a door-to-door demand responsive service. It's ADA compliant, and anyone can use it if you live in specific rural areas, Hepsburg, McBlean, and Blythe. In 2025, 10,210 trips were made, and it is funded by the 5311 funds, rural transit funds. And that's a typical brand it's the Let's Ride with the distinct telephone number. The MPO for the county is the Augusta Regional Transportation Study, ARTS for short. It's a bi-state MPO, straddles the Savannah River, encompasses parts of Edgefield County, Aiken County in South Carolina, 100% of Richmond County in Georgia, and a significant portion of Columbia County in Georgia as well. The planning area is 806 square miles, and the population as at 2020 was 492,000. And Augusta Transit is a member of the Arts Policy Committee that forms the policy and enacts policy at the MPO. Now, before the 2020 census, Richmond Transit, our rural operator, operated basically south of the I-520. The I-520 is sort of circumferential interstate that starts in West Augusta on the I-20. It goes to the south and then back up north through South Carolina and connects back to the I-20 in Aiken, South Carolina. As you can see, the green dashed line, everywhere south, southeast, and southwest of the I-520 was a service area for Richmond Transit, which included Fort Gordon Military Base, Augusta Regional Airport, Hepsburg, McBean, and Blythe. In 2020, there were 47 census tracts for the complete Richmond County. And of those census tracts, 16% were south or southwest of the I-520. In other words, 34% of the census tracts in Richmond County was south of the I-520. And 10 of those 16 tracts were classified as urbanized. And this has a direct significance as to the shifting urban-rural boundaries. Now, in 2020, when the decennial census was taken, some of the census tracts in South Augusta that were classified as rural in previous censuses were reclassified to urban because of the increased population and increased residential industrial density. Now, what this diagram here is showing is Richmond County. You see the fixed route networks and the 3/4 mile buffer around the fixed route. You also see the I-520. You see the rural area in green, and then you see the urbanized area in the light green and the blue. The rural area is teal green, and then you have the light green within the I-520, that's 100% urbanized. But what you see here is where we currently are. We have the fixed route, we have the rural transit, which operates within the green area, but can take people from the green area, from the rural area, to anywhere in the urbanized area. So that was a result of the decennial census. Some census tracts which were classified as rural were reclassified as urban because of the increasing population and densification. And this area of focus is typically called South Augusta. You can see Tobacco Road there. It starts from Fort Gordon and goes all the way to the east to end at Augusta Regional Airport. And the area of focus is within that dotted rectangle. In 2020, Richmond County had 56 census tracts, and 23% of those census tracts were completely outside of the 520 to the south and southeast, southwest of the I-520. Approximately 105,000 persons live outside of the I-520. And of those 105, 69,000 live in the South Augusta urbanized area. In other words, the blue, 69,000 people live there. So approximately half of the population of Augusta Richmond County live south of the I-520, and 1 in 3 of the population of Richmond County live within the urbanized parts of South Augusta, which is denoted in the blue. Now, as I said before, we have transit in the rural areas, the green. We have transit in the urbanized areas, and you see the 3/4 of a mile buffer, but we do not have a transit service in the blue area, and that has become a transit desert. The blue area has, over the years, become increasingly populated and increasingly increased in densification. The blue area has, South Augusta has lots of, good paying jobs, has grocery shopping opportunities, affordable housing, and medical facilities. What has happened over time is people are relocating from the transit rich areas to the South Augusta because of affordable housing. And when these people get there, especially if they do not have a car, they realize, wait a minute, there's no transit here. How can we get to the grocery store? How can we get to our jobs? And we know that there is a significant pent-up, robust demand in South Augusta, which is unfortunately unserved by transit. Now, why microtransit for South Augusta? South Augusta is still very much a suburban community, and fixed routes sometimes do not operate efficiently in suburban areas which are sprawled. Microtransit has a short lead-up time when compared to fixed route. For fixed route, to extend our service there, we would have to have more buses. We recently purchased electric buses. They were $1.1 million each, and now they're $1.3 million each. A diesel bus is around $800,000 each, compared to a cutaway van, which is a very effective microtransit vehicle. We cannot use our rural transit, Richmond Transit vehicle to pick up people who live in South Augusta. There are people who live in South Augusta that do use our rural service, but they have been grandfathered in because they were using our Richmond Transit service before the 2020 census. So we have not disenfranchised riders who were riding before 2020, but we have not taken on new riders who live in South Augusta. And that's very frustrating for many people because they see this they see the rural transit van pick up their neighbor, and they call Augusta Transit, well, why can we sign up for this service? And we have to deny them. Also, microtransit, it offers real-time planning. It's a shared ride service, and there's proven operational benefits and customer appeal. And there's 2 types of services, the software as a service and the turnkey. We would like to adopt the software as a service, and we have purchased the microtransit service through VIA. How does microtransit work? Microtransit, simply put, is an Uber Lyft type service that is operated by the public transit agency. You decide on the trip, you book a ride through your phone, or you can call. You pay for the trip virtually or with vouchers. You walk to a virtual travel bus stop. If you are mobility challenged, it will come to your door. A van arrives within a few minutes. You ride to your destination, and it's a shared ride. Therefore, other riders may board the vehicle, and you arrive at your destination or a virtual bus stop. For able-bodied riders, they are encouraged to walk to a virtual bus stop, and you are dropped off at a virtual bus stop, so you then have to maybe walk a block to your actual destination. There's quite a few examples of microtransit systems currently operating in Georgia. We have Buck Ride in Buckhead. We have CAT Smart Transit in Chatham County, Savannah. We have CAT's Microtransit in Cherokee County. We have Cobb Link in Cobb County. We have Gateway in Norcross, Gwinnett County. We have Henry Connect Microtransit in McDonough County. We have Ride Gwinnett in Snellville, Lawrenceville, Norcross. We have Shift on Demand, Atlanta Airport, and then we have Valdosta on Demand in Valdosta, and we have WeGo in Hall County. There's quite a few microtransit. The one thing that's very common, very relevant, once microtransit starts, it simply grows exponentially. Now, there are some arguments against microtransit. One, funding needs and sources. Well, that's the challenge as to why we have not started microtransit as yet in South Augusta, in Augusta Richmond County, at Augusta Transit. We are trying to source funding. There are federal dollars, but they require a local match. And sometimes we are challenging getting the local match from the city of Augusta. There's also a potential to disadvantage the unbanked because everything is through your phone. If you don't have a smartphone, you may not be able to use microtransit. However, you can call ahead, and in some systems, you can go to your Family Dollar, you can load up a card, and you can pay for trips using a smart card. It can be expensive if you cross multiple zones. Many micro transit systems have different zones. And so when you have rides within one zone, for example, the Buck in Buckhead, if you ride within a specific zone, microtransit trips are free. If you ride to certain MARTA stations, there is a cost. Microtransit is not door to door for in some systems for able-bodied person. You have virtual bus stops, but if you're mobility challenged, like in a wheelchair, it is door to door. Operators must follow audible directions, and some drivers like to make their own way to pick up a person and to drop off a person, but with microtransit, you follow audible directions. And the popularity of microtransit may become so great, you have to deny trips, have to deny riders. Now, microtransit benefits for South Augusta. One, there'd be no break-in transit services. As I have said before, South Augusta is a transit desert. Richmond Transit rural buses do pass through South Augusta, but they do not pick up new riders. And then we have fixed route within the I-520. So one of the advantages of having microtransit, it will integrate Richmond County completely into the transit system. Microtransit is open to everyone. It's not like ADA paratransit, which is just open to mobility challenge riders. Real-time booking, people prefer that you can book rides as you need them rather than book a day before, 2 days before. Microtransit uses algorithms to determine which is the best way of getting between A and B. That's why drivers have to listen to audible driving commands because the algorithms are working, taking into account congestion, taking into account, we have lots of at-grade crossings here in Augusta, Richmond County, and trains sometimes park on the track. So with microtransit, having that information, being able to direct drivers will allow for a faster trip. It's a passenger-facing mobile application. Rather than calling ahead, you can do everything through your phone and see the vehicle approaching. It's also a cloud-based system, and it doesn't depend on a server. Here at the City of Augusta, it's 100% ADA compatible. All of our vehicles here at Augusta Transit and Richmond Transit are ADA compatible and can take at least 2 wheelchairs. And also, one advantage of microtransit, it allows riders to report on customer service and tell us how they are getting to their destination. It collects lots of data that tells us where the demand is, where are people going, and the trip patterns in real time. And that is very, very useful for future trip planning, and especially looking into starting a fixed route in areas that may sustain a fixed route service. The MPO role and microtransit. One, microtransit, we have applied for some federal funding, and one of the requirements is that microtransit is included in the TIP and the Metropolitan Planning Plan, the MTP, Transportation Plan. So we have been working very closely with our MPO to ensure that our microtransit, potential microtransit service is included in the TIP and included in the Metropolitan Transportation Plan. Our MPO Arts has been has partnered with us to plan and study microtransit and look at potential pilot studies with Augusta Transit. We have received funds to look at the benefits of riders who didn't use transit because of it was unavailable, but they use it, and how do they improve their well-being through the transit service? And we have received some funds to do a study working with a local nonprofit. But since we have not started microtransit as yet, we cannot commence that study. Also, the MPO allows us to coordinate the different microtransit projects within the MPO area. Right now, there isn't a microtransit in any of the suburban, urban, rural areas of the arts planning area. That's in Aiken County, Edgefield County, Columbia County, and Richmond County. All four counties do have ADA paratransit services or on-demand services, but they have to be booked and riders have to be registered. And also our MPO is very helpful with sourcing different funds. We are able to use the 5303 FTA planning funds, working with the MPO to fund some of these feasibility studies that we would like to do regarding microtransit. At the same time, they are a partner when we apply for other discretionary grants to fund the microtransit service that we would like to commence in South Augusta. We have worked with our MPO in project performance monitoring and evaluation regarding other transportation modes that we operate here. So our MPO has been a good close partner to us as we try to meet the needs of citizens, visitors in Richmond County when it comes to public transportation. And that is the end of my presentation.
Okay, thank you, Dr. Page. We have questions in the chat.
Let me stop sharing.
Okay. I'll read the one question out that we received during your presentation. Several states like Florida, Tennessee, Oregon, etc., have moved to at least 5 context classifications: urban core, urban, suburban, rural town, and rural. The FTA formula funds are currently only urban or rural. Do you think the formula should expand to include suburban and rural town areas like the dark blue areas in the South Augusta map? Or are the formulas too complex to change and the rural funding covers enough area even though there's not enough funding?
Now I'm trying to unshare my screen.
Okay.
I don't see. Can you unshare my screen or yeah, good. Now what we have found, remember, as I said before, the current fixed route operates predominantly within the I-520, which is completely urban. But that blue area is also urbanized as well. Right now, we don't have enough vehicles to provide an adequate service to serve that blue. Richmond County is 329 square miles, and Tobacco Road is at least 10 miles away from downtown. For a typical fixed route bus to cover that distance, it could take at least an hour, considering all the stops. That's not attractive for any person who would want to take a bus and have to transfer where their ride is more than an hour to 90 minutes. So the 5307 funds that we do have are just not enough for us to invest in vehicles to serve South Augusta. That's why we have to apply for discretionary funding, and we have applied for congressionally directed spending to allow us to get additional vehicles. Getting drivers for those vehicles shouldn't be too difficult because we contract out our services and it's the contractor who provides the staff to maintain and operate our vehicles. So currently our 5307 funds, we could use those funds to purchase 1 or 2 vehicles and we will get the local match from the city. However, given the contractor will expect more income because they're providing more revenue out of service, that might be a very tight squeeze for Augusta Transit. We need more vehicles to be able to adequately serve South Augusta, the transit desert, and microtransit offers a low cost and short startup method of doing that rather than investing more in our fixed route fleet. I hope I've answered the question.
I think so. I think that you provided a good alternative with the microtransit, so I think that's a good option. I don't see any other questions in the chat, so I will move on to the polls. And if you do have questions, please still put them in the chat. Let's see. Question number 2 is, does your MPO serve rural areas in your region? So this is a simple yes or no. I'll leave this up for just a minute. Okay, it looks like we're completed. It's kind of fluctuating. There are 84% of our responses are yes, and 16% say no. There's one. Oops. But those are the responses. And then there's one final poll question, which is, what challenges do you see in providing rural transit? And I see in the chat someone selected D, all of the above. Okay, lack of drivers. A couple of people are saying all of those. I will end the poll and share the response. Our larger commission supports rural transit. Okay. Looks like the biggest challenge is funding, but I will end the poll now and share the results so you can see them. That is all we have. Thank you so much to Mr. Benson and Dr. Page. We appreciate you.
Can I just go back to that question? Just to make clear that the blue area is urbanized, which is covered by 5307. And that necessitates that the rural transit bus that operates in the green and passes through the blue, you can live in rural South Augusta and go to anywhere in the blue area or within the I-520, because at least one end of the trip is in the rural area, which is governed by 5311. However, the blue area of South Augusta, which is 5307, we don't have any transit there, and it's too far south from our current fixed route network. So the 5307 funds cover all the urban areas, including the urbanized part of South Augusta.
Okay. Thank you for that, Dr. Page. Ellen has asked in the chat, are there any last questions or anything you would like to bring up? I'm also the secretary of the Georgia Transit Association. Excuse me, I don't know why it's gone. And I would encourage all the MPOs represented here to connect with their respective transit agencies and see if they are members of the state Transit Association. We are also members of the Community Transportation Association of America, based in Washington, D.C. And last week, I was in Washington along with other transit agencies, meeting our elected officials to advocate for transit. I think it's extremely important that transit agencies participate in going to the state capitol to advocate for transit, especially the rural transit agencies, because sometimes the legislators, the elected officials don't understand how transit works and don't understand how rural transit works or how the MPO works. So when you take advantage of going to meet their staffers, going up to the state capitol or national capitol to showcase your transit system and to advocate for transit,
That's a very good way of increasing awareness of the challenges that transit agencies face, MPOs face, in serving citizens with a decent transit service.
Thank you, Dr. Page. Those are good points. Ellen, ready to?
Sure, I can close it out. Again, want to echo the point Dr. Page just made, that there's kind of the misconceptions about transit, and that's why I'm glad we could do this webinar focused on rural and suburban and other forms of transit, because it's not just a big city issue. It's certainly a big city issue, but it's also a suburban and rural issue. And we've got someone here from the Center for Urban Transit. Jonathan, do you want to unmute and share a little more about the point you just made there?
Sure, Ellen, can you hear me?
Yep.
Thank you. Thanks. Yeah, we're working with a number of small urban and rural transit agencies in the state of Florida, and we've seen where microtransit was implemented in small urban or rural areas, sometimes replacing fixed route. But in some cases, some agencies are finding that it is, this is in quotation marks, too popular and therefore too expensive on current budgets. So they end up having to limit the trip types, in some cases to ADA, or in Florida's case, transportation disadvantage program requirements, low income, and so on. So we have seen that sometimes it's too successful in a way that it exceeds current budgets. So I'll be curious to see if anybody else has run into that, or if it relates to some of the things we've already heard or will be hearing. Thank you.
So it kind of relates to, Megan, what we run into pretty regularly in our systems. And we kind of combat that by using purchase of service trips in those systems. So we're constantly looking and saying, can your trips be paid for under Medicaid or Medicare? Like, are you going to a doctor's appointment? And that kind of helps offset the expense of operating those trips. And it allows us to provide the same service to the same people and have it paid for by somebody other than the MPO or the regional system or rural system. Kind of helps remove some of the funding burden.
Yeah, I agree, because those purchase of service contracts serve as match essentially towards that federal grant. So those are critical in order to maintain that at a low cost for local governments. So we're really appreciative of our purchase of service contract relationships that we have with different organizations, and RMS actually maintains those for us. So they do a really good job of that.
All right, well, if we don't have any further questions or discussion, I really appreciate all of you joining us today. Thank you so much to Dr. Page and to Stone for speaking with us. Really grateful for the insight you were able to share. And Megan, thank you so much for pulling this webinar together and for being part of our transit interest group. I'll just put out a plug for interest group leadership here at AMPO. We will do a call for leadership for next year, sometime this summer. That's something to keep an eye out for all of you who are AMPO members. Anyone who's MPO is a member of AMPO can serve on one of our interest groups and help us to shape this discussion among MPOs. We also are getting close to closing registration, or going to a wait list for registration for our symposium, which is coming up in April in Lexington, Kentucky. So if that's an event you were hoping to come to, we'd encourage folks to get registered soon, and we'll soon be opening registration probably sometime in May, early May, for our annual conference, which is coming up this fall in Sacramento, California. So a couple of AMPO events to keep your eye out for. With that, we will wrap it up. Thank you so much for joining us, and hope to see you at another AMPO webinar soon down the road. Take care, everyone.